Call to order our Sherburne County Board of Commissioners meeting for August 17th. Please rise for a moment of silence and the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, at this time, I'd be looking for a motion to approve our regular meeting proposed agenda if there are no additions or deletions.
I'll move approval.
Motion made by Commissioner Phobie. Seconded by Commissioner Brandt. Any further discussion? Hearing none. All those in favor signify by saying aye.
Aye.
All those opposed, same sign. That motion carries. Moving on to items on our consent agenda. Are there any additions or deletions from the consent agenda? Okay, motion made by Commissioner Dolan. Seconded by Commissioner Brandt. Any further discussion? Hearing none. All those in favor signify by saying aye. Aye. All those opposed, same sign. That motion carries. Okay, moving on to our announcements. Mr. Meslet, what do you have for announcements?
Thank you, Madam Chair, members of the commission. Just one announcement, a reminder that we do have a luncheon at noon today for our public health officials who worked so hard during the last year for COVID-19. That will be back here in the boardroom, and hopefully some of you will be able to either to come back or to attend that.
Moving on to item number 4 on the agenda is our open forum. Keisha, do we have anybody signed up?
We have nobody signed up, Madam Chair.
Okay, you were here for open forum? Okay, are you just gonna be the speaker? Okay, then go to the podium, state your name and address. You have 3 minutes. Okay.
Before you leave, just mind signing up. There's a sheet of paper back there.
Okay. All right, welcome.
Hi, thank you. Thank you, Ms. Chair and Commissioners. I spoke with you, Ms. Chair, last week and wrote you an email. We started the process of buying Big Lake Auto from Jesse Olson in March of 2021. His business is located at 20110 West Highway 10. He's been in business for 30 years. He sold and used car sales, repaired cars, and even sold used parts. We were interested in Jesse's property because we didn't want to buy it unless we could continue the business without going through 2 to 3 months of the IUP process, which at the end was no guarantee that we could operate. We had Jesse's attorney contact the county zoning to see what was needed. We met with my husband and my father met with Mark Schneider in his office and went over our business model. To see if we could buy Jesse's place and continue to have used car sales by multiple dealers in it. Basically, to be an incubator for small used car dealers and repair cars on site. Then we got a determination email on May 3rd, 2021, and Mark said in his email that our business model was legal, non-conforming use that may continue new ownership without the need for IUP. So then we continued the purchase of the property and invested our life savings of $100,000 to get the loan to purchase the property. We finally closed on the property this month and started to rent out the used car dealership offices and repair shops. And as started the state requirement, we have to have the zoning verification for signed by the county zoning officials to turn into the state. We went to the city zoning office, and they now are refusing to sign this form, saying that we need to apply for an IUP. This new ruling is causing extreme hardship for us. We can no longer get the income as to proceed to develop the property and improve the property. We've contracted for a $17,000 new septic system. We've hired an architect to drop new plans. We've ordered $27,000 of building materials. We've started upgrading the property, painting, cutting weeds. We've cleaned up the lot. And this change of the written ruling is extreme hardship on us. So we'd like to ask you, the commissioners, to have the zoning honor the deal and ruling regarding the non-conforming use so that we can begin operations and start making money on this. It's been since 1994 that this was upheld, that we were able to have the non-conforming on this, and we would just like to start making money on the property that was told to us that we were able to use it, as it was said. Thank
Okay,
you.
Sarah, thank you for bringing this forward, and someone will be reaching out to you.
All right,
All right.
Thank you.
Very much for
Madam Chair,
coming out.
Could we
Yes.
just get the name? I
Oh,
missed-
Sarah, could you
missed
say your name again,
oh,
please?
sorry, it's Sarah Hofdahl.
Yeah, thanks, Sarah.
Thank you. All right. With no one else being signed up for open forum, were you going to speak to the same thing?
I don't need to say much more, but we have a written thing.
Okay, that's fine. You can give it to the administrator, okay? All right, thank you. Thank you for coming out.
Thank you.
Thank you. Okay, that will close the open forum at this time. Moving on to our regular agenda. Looking to receive an update from the Minnesota InterCounty Association, otherwise referred to as MICA. We got to get our acronyms in here. Good morning.
Good morning, Madam Chair and Commissioners. Matt Mossman, Executive Director of the Minnesota InterCounty Association. I always start with thanking you and appreciate Sherburne County's membership, and Commissioners Phobie and Schmiesing for your service to the MICA board and helping set our agenda and drive our vision forward. Really, we always look forward and are grateful to be out here in person in Sherburne County with you this morning. I know we missed that opportunity last year, but it really does mean a lot to us and is helpful to us, frankly, to get out to the member counties. And so we're going to do a brief presentation today of some of the successes of the last legislative session, but it's also helpful to leave as much time as possible to hear from you, frankly, about what you're thinking and feeling for the upcoming session for priorities also. So if we make sure I got this working here. There we go. You know, I would also just say that we're going to touch on a few things. We have a 40-page end of session summary document that focuses on just items, frankly, that impact county governments that happened during the last regular session and special session by the time the budget was passed. So a lot happens that we follow. And frankly, there's some additional items that happen that in our association we work with partners more and that we don't follow closely. In the end of the day, the legislature passed a two-year $52 billion budget. The path to that was smoothed by a significant state surplus of $1.7 billion and, of course, the state's $2.8 billion of ARP funds. Many, if not most, of the contentious policy issues went by the wayside in what is the only party-divided control legislature in the country, as I think you know. The counties, frankly, were pretty successful given all of that context. Tax aids and credits, I just want to emphasize that this was a really important area in intergovernmental aids where we went in. I want to compliment Sherburne County along with all other counties and how effectively you used your CARES Act dollars. We were happy to help get such a significant amount of CARES Act dollars distributed to counties. But I think there's a lot of goodwill built up with the legislature that really meant as we went into the legislative session prior to a surplus when we thought there was a deficit, there was virtually nobody in the legislature talking about cutting county government. And so that I think is attributable to the relationship and goodwill we've established. We did come out of it with some additional aids as well as some benefits that will accrue to taxpayers in your communities that I think they will find important. There was a new $20 million a year homeless prevention aid program. It'll be about $163,000 a year. So a significant amount of money, almost $1 million over the course of the 6-year pilot program for Sherburne County to support efforts that you might already be doing in that area or could do in that area. It's focused on youth, households in particular, and youth that are homeless or at risk of being homeless. There was a cut in business taxes of $20 million a year, so it'll particularly, I think, be very recognizable for small businesses because the amount that is exempt from that state property tax now is going to increase from the first $100,000 to the first $150,000 in value. So if you have small business owners, they will see that decrease in pay 2023 that will start. Exclusion, also your veterans in your community will see higher renter refunds or homeowner refunds. Just want to call that out because they will be able to exclude the income they get from the federal government for their disability benefits, and so they'll be eligible for higher refunds. Broadband was a significant success that went back and forth. There's a lot of federal money that's been flowing to broadband, but we were consistently bringing the message to the legislature that we're not at risk of overspending on broadband. It's a significant challenge still in a lot of communities in greater Minnesota as well as populated communities to fill in and make sure that speeds are, Minnesota remains ahead of the curve in broadband for both unserved and underserved areas. The legislature is currently acting on, and then I'm going to stop here and turn it over to Mr. Novak. The legislature is currently working on trying to decide on a recommendation for allocating $250 million in the state's federal money for a frontline worker pay program. I point this out because this was an important, there was legislation during the session that would have required local governments and private employers, all employers in Minnesota, to retroactively provide up to 80 hours of paid leave for workers that did not already have access to paid leave under certain categories of employees during legislative session. That did not happen. What happened was this instead. And so there's a discussion going on right now around how that will be allocated, and we're expecting that that will precipitate a September special session of the legislature as well. During which we and many others are also pushing for and hoping for a revisit of the bonding bill that did not pass last legislative session. Oftentimes there's a small bonding bill that follows up the larger bill of the previous session that passed in October. So we are working on that. Your Main Street businesses also got additional relief as a result of money, federal money that was allocated in the economic development bill. With that, I'll turn it over to Steve to talk about transportation funding.
Good morning.
Thank you. Good morning. It's always good to be in Sherburne County. I enjoyed one of your local bakeries this morning before we came over. Let me go right to it in terms of transportation. In the last, I would say, 8 months, transportation has been doing fairly well in Minnesota government and hopefully soon with the federal government in terms of delivering money to the kinds of programs that we historically support. To be specific, in the transportation funding bill, as is noted on the slide up here, we continue to make improvement in local road and county bridge programs, $14 million for bridge, $5.5 million for roads. It's important to keep in mind that that comes on top of the work of last October's special session, where there was $70 million in new money for local roads and about $30 million, excuse me, for local bridges. So the combined total on a 20-year spectrum of time represents significant progress in these two areas. In addition, I know Sherburne County has both city streets and town roads, and the $12 million for town roads and the $18 million for small city streets was a real breakthrough in those two categories, again, compared to the last 20 to 25 years. So combined, that was a good package between October and this year's bill. In addition, and I know this is an issue from many county boards around the state, including, I believe, this one, they provided $2.6 million each year to reopen all of the remaining closed driver's license bureaus that were closed because of the pandemic. And then I just want to touch on one of the highlights of the bill, which concluded many months of negotiations between the House, Senate, and the governor. But there was $113 million in trunk highway funding and $30.9 million in general funds for specific highway projects around the state, one of them being in Sherburne County, where there was will be some significant work done as a result. I just want to touch on what we've all been reading about, and we're looking forward to hopefully it being completed. But the so-called bipartisan federal infrastructure bill has now passed the Senate, as I think you've read. Clearly the votes are there in the House if they can get their own politics straightened out, which is getting twisted because of the next package coming through, which by definition apparently will be far more partisan, the $3.5 trillion. But the first one, the bipartisan one, which has passed the Senate, is $1.2 trillion. There's about $600 billion in new money in that package, and possibly you read the explanation of the bill in the Star Tribune here about a week ago, but it will be a significant bill for the state of Minnesota compared to many other states around the country when it comes to funding for roads, bridges, ports, and airports. So I think we're all very hopeful about that, and it looks better than it has for a few years now. Last thing I want to touch on is I know some of you attend the annual Washington, D.C. fly-in. Just a reminder that the dates this year are September 21st through the 23rd. All the years they've been doing this, this may be one of the more interesting and on-point meetings that has happened more by luck than timing. But the fact of the matter is, by that date in September, there's a strong likelihood that the bipartisan infrastructure bill will have passed. They have meetings set up with most of the congressional delegations, so those of you who are participating or still trying to decide whether to participate, it looks like it will be a good conference this year. With that, I would conclude and be happy to answer any questions.
Any questions? No, thank you for the update, and we're all just as excited to see a really robust bonding bill for infrastructure and roads come. Good morning.
Good morning, sorry. Good morning, Madam Chair and Commissioners. I'm Nancy Selesky, and I represent MICA in the area of Public Health and Human Services, and it's a pleasure to be here this morning. I always laugh at this slide because there are like 7 bullets or something like that, and the report that's in your hands is about 20 pages of Health and Human Services. So as you know, there's a lot in this area. This year was really, really good for public health. Want to highlight and start with that. Nothing like a pandemic to get everyone's attention as far as the importance of public health. For the first time in many years, the local public health grant was increased by about 30%, so that's $15 million additionally in the next 2 biennia. They also put $15 million in each biennium for a new local public health funding distribution framework or infrastructure for local public health, $8 million per biennium into tobacco and vaping prevention, and a $3 million increase in the home visiting grant program. So those were the highlights in terms of funding. I also want to just highlight that there was at one time a proposal to reduce the statewide health improvement program, the SHIP program. That did not happen. That fell by the wayside at the end. So that was good news in public health. In terms of human services, we also were quite successful in a number of county priorities. Excuse me. The first one is the IMD accounting error. This was something that all 87 counties were working hard on. This related to a DHS error where we would have been responsible for about $8.3 million on a statewide basis, and we did come to an agreement and got that resolved. So that is off the table. Also, there was a county waiver bill that was introduced that had 4 initiatives. Just want to call out Commissioner Phobie was very active in the area of identifying which waivers we'd like to see continued, et cetera. And with that, we introduced a bill again that had 4 initiatives. I'll just mention them quickly. These are all permanent now. They relate to targeted case management, min choices reassessments, if both the client and the county agree, they can be done remotely. Also, we modified the number of days a person can be absent and still receive housing support. That was modified. And we can now take MFIP applications remotely. Those were the 4 initiatives that were in our bill. Also want to mention a bill that passed during the regular session that Sherburne County was very, very much pushing and active and took the lead on, and that relates to allowing 5 days for a face-to-face visit with the child that's in the child protection system if it's confirmed that there's no contact with, that there's no danger of contact with the alleged offender. So that happened during the regular session. If you look at the report in the telehealth article, there are literally dozens of other waivers that also were addressed that you can look at. The legislature also invested in mental health. They put $1.75 million of an increase in the Adult Mental Health Initiative Grant Program for the next 3 years. They also put $16 million in additional capacity for grants related to the Adult Mobile Crisis Services Program. And then there's the, excuse me, a new program, $5 million to create a children's mental health transition and support team to transition kids back into the community that are currently at psychiatric residential treatment facilities or the Child and Adolescent Behavioral Health Hospital in Wilmer. So they put money into that program as well. Unfortunately, we did pick up one county cost shift, and that does deal with the child and adolescent facility in Wilmer. When a child no longer needs that level of hospitalization, counties pay 100% of the cost relative to that placement until a new placement has been located for that child. And that's about a $2.4 million cost across the state for counties per biennium. The end of a special session, they did come to an agreement on the eviction moratorium. That was something that was discussed throughout the session, and that this was included in the final package. Under the deal, a landlord cannot terminate or not renew a lease for 105 days of enactment of the bill, which brings us to October, that a person has to have that kind of notice, the three months before they could be evicted. There is an exception if a person is violating the lease in a different way other than for non-payment of rent. If they're damaging property or some sort of a danger, then the landlord can evict that person. And before an eviction can be done, the landlord does have to provide a 15-day notice to the tenant. This off-ramp was intended to direct people to the Minnesota website, the state website, which is renthelpmin.org. The state has received almost $700 million in federal funds related to rental assistance that Congress passed. And this is intended to not only help the client or the tenant, but also to keep the landlord whole. We just mentioned a couple things that did not happen. There were 3 cost shifts that were presented or proposed in the Senate. None of those did happen. They would have been a cost to counties in all 3 cases, dealing with min choices assessments, disability waiver allocations, and also there would have been a cost share for placements of disabled individuals that were 18 to 17 in certain settings. None of those things did happen. With that, I just want to call out several members of your staff that I work very closely with, Amanda Larson, Jody Hiring, Nicole Ruhoff, who's new with Public Health this year. Work with them. They're just wonderful in terms of representing not only Sherburne County, but counties as a whole.
Thank
And
you.
I'd be happy to answer any questions.
Any questions? No, thank you very much for your report.
Thank you, Madam Chair.
Good morning, Madam Chair and members of the board. I'm Carly Stark, and I do public safety for MICA. So the best news is that there was an increase in the Community Corrections Act subsidy. It's $1.22 million fiscal year 22, and then another in fiscal year 23. The bad news about that is that it is only one-time funding, so it will only be for this biennium, and then it will go back to where it was previously. If I read the right line on my spreadsheet and did the correct math, I think that's a $30,000 increase for Sherburne County, approximately. One of the good things that went with it, though, is that there is a community supervision study group, which will talk about supervision standards and also look at the funding structure to make sure that the county and the state are equitably funded, because right now, as you probably know, the state gets increases pretty much every biennium and the counties don't. So we want to fix that for the long term going forward. The 911 telecommunications fee was decreased from 95 cents to 80 cents. We had tried to keep that at 95 cents to keep that extra money around for the change to Next Gen 911. Despite that decrease, though, the state did double the amount that public safety answering points get, which will help with, equipment in dispatch centers and things like that. The other unfortunate news is that there was no emergency management readiness grants. There was a proposal to do $3 million per year, and it made it into the House Omnibus bill. But unfortunately, I think because of all of the federal funding, it did not get passed in the final bill. There was a lot of talk about how there were so many emergency management federal funds. However, we will keep working on that because it's, those federal funds are here now, but we want to make sure that there's some kind of ongoing funding for emergency management. There were a lot more things that happened, but I will stay brief and answer any questions you may have.
Any questions? I'm sure Jay will be happy with that extra 30,000 for this year.
Oh yes, I guess I should mention Jay does a really good job representing Sherburne County on the MACAC board. He lets me know what he thinks and is a good advocate.
No,
for
he
you.
does?
He does.
That's surprising.
Yeah, so thank you.
All right, thank you. Thank you.
Well, thank you all. I'll just wrap up by saying, frankly, I'll let you, there was a number of other things. Obviously, in environment as well, there was more SCORE grants for counties. Landfill and other issues have been getting more money, funding for groundwater, septic systems, replacement in rural areas, increased funding for invasive species. We're starting to get some solutions for counties that are operating licensing bureaus. We got language that works for counties now on self-service kiosks so that they can retain those transaction fees in the county that's operating them. So a number of other good things. Let me just end by, first of all, saying our phone numbers for all of the team and thank my team are at the end of this PowerPoint. We're happy to entertain questions directly from any of you. If you are going through and you want to know what happened or want more specifics on anything that's in the summary, please let us know. And obviously at this time, we start shifting not only to monitoring the September special session and continuing to advocate for a bonding bill, but also making plans for the 2022 session and taking and listening to counties for your priorities. We do anticipate it to be a pretty healthy budget condition that the state will head into for this second year. A contentious political environment perhaps, but a healthy budget environment. The state still has $1.2 billion of their federal money unallocated, and they ended the last biennium with $2.7 billion of collections estimated in addition to the forecast. So that's good news. We'll see what happens. We're hoping that that means a big bonding bill and some robust activity to fund important infrastructure. Happy to take any questions.
Any questions? No, we want to thank you for your partnership and all that you work so hard on our behalfs to get done down at the state, and can't do it without working together, so we appreciate that.
Good, thank you, Madam Chair.
You have some?
Did you have something, Bruce?
With the board's permission, I was just going to ask a quick question about essential worker funding real quick. Okay. Matt, I was wondering if you'd quickly just address for the board, since we're in our budget discussions and we're working on ARPA, where you see that debate at the state level going essential workers, and in particular, some of the background noise where, our county's going to be asked and city's going to be asked to cover public workers, or do you think the state's going to figure this out?
Yeah. No, great question, and that's kind of exactly why we're monitoring it. To be honest, we've made a conscientious decision on as an association to sort of stay on the sidelines because we are. There was a little bit of chatter at the end of session about recognizing the county's got $1.1 billion directly, and maybe they can use their own money for some things. So that dynamic started to come into the conversation. As of right now, the focus in the public discussions has been on healthcare workers, long-term care workers. I know that the House is likely to want to bring in also retail workers and low-income workers. I think that there is some possibility that to the extent there's any classes of employees that are sort of apples to apples comparison with frontline workers in the private sector, that there might be an expectation that they also be covered. And if that happens, it's certainly possible that they would just tell counties to do that rather than having that come from the $250 million. So that's one of the things, I assume if that happens, it would be a modest impact. I think most counties already provided under the FFCRA the up to 80 hours. So that's what we're monitoring. I think there could be some fallback onto counties, but as of right now, we frankly are not also asking for part of that $250 million because I think we would be at significant risk of rubbing folks the wrong way given the federal money that came directly to counties. So it's a little bit of a balancing act that we're playing there.
Any other questions? Thank you very much.
Thank you, Madam Chair and members.
All right, moving on to our next item on our agenda, 5.2, consider and approve the resolution 081721-AD-2058 establishing the Sherburne County Emergency Assistance Program. And it looks like we have Amanda and Gina. Oh, maybe just Gina. Oh, Amanda's gonna, okay. She's like, here's Amanda.
Sorry. Good morning. You'll see that HHS has a few requests in front of you this morning. Kind of feels like we're at mile 20 of a really long marathon because you've probably heard about most of these before. They've been percolating for quite some time. But just again to kind of give you an overview, we know that the effects of COVID have changed how people access services, which have also changed the way that we need to deliver services. We also know that people have inequitable access to different services, and the pandemic has really exacerbated those. We also know that the effects of the pandemic have taken a toll, particularly on mental health and well-being. So the HHS budget reflects that in several areas, as well as our ARPA requests. We've been working hard to match our ARPA requests with federal guidance to identify areas most in need of support, and then also mirror our agency commitment to prevention. And also, we have highlighted sustainability in all of our requests because that's very much first and foremost because we know that ARPA funds is for a limited period of time. So with that, I think Gina is going to first talk about our expanded economic assistance policy.
Good morning, Madam Chair and Commissioners.
Good morning.
My name is Gina Anderson. I'm a manager in Health and Human Services, and I'm here this morning on behalf of our agency to request approval of the draft resolution to establish an emergency assistance program and to request to allocate $100,000 for this program from the county's ARPA funding. This program would run through December 31st, 2024, and would supplement and expand on our current public assistance emergency programs in order to provide assistance for more individuals and families, specifically targeting those who are in a situation, crisis situation due to a reduction in household income or have experienced other financial hardships due to the pandemic. It would cover emergencies in which the client is without or could potentially lose housing, utilities, to help provide transportation that otherwise would affect them gaining or maintaining meaningful employment, assistance needed for burials due to COVID-related deaths, and medical expenses that threaten the health and safety of any household unit members. So those are the categories that this program would cover. Are there any questions I could answer?
I do have a question in regards to, doesn't a lot of this fall under the housing, like if, that we were just talking about with Micah?
Help. So it is true that that program has been established for those folks who are behind currently on their rent. What we are seeing, however, is that we are already getting clients who are being evicted, and we're guiding them through MN Rent Help, but it is cumbersome right now. They're very overloaded, and the evictions are coming up before they have time to go through the process of getting help from that program at this time.
My understanding of that program was that if they were in the queue, that no one could be evicted while they were waiting for their
This,
recommendation, for the support.
correct, that is what's been established, but it's not always being followed.
Okay. Any other questions?
Madam Chair, and if I remember back, we did a similar program with CARES Act funding. I believe that it's kind of the
Correct.
stopgap, the little bit of extra burden that we have because of what's going on. So it almost mirrors what we did with CARES Act dollars, if I remember.
That's correct, Commissioner. And when we established that, at that time, there was still the moratorium on evictions, but we were still expended approximately $3,000 to $3,500 a month for those several months that we had it. And that didn't cover any evictions at that time. So even without that, and even with having this other program available, which we will continue to refer our clients to, but in those situations where that program is not working for them, we would be able to have this other opportunity. But in addition, as Commissioner Dolan stated, with our CARES program, when we had that, we didn't touch any evictions at that time, and we were still expending about $3,000 to $3,500 a month on these other areas.
Okay. Any other questions for Gina?
Madam Chair,
Yes.
Gina,
Mr.
okay,
Swayze?
so the money that was expended, where did that go?
From the CARES dollars
The
that we spent?
3,000 to
It
3,500?
varied. It was, a lot were for utilities, for car repairs to help people who needed that transportation to maintain employment.
But not to pay rent?
No, none of it was used to pay rent. At that time, it was, people were all following the guidelines for the moratorium, and we weren't seeing a need for clients coming in to request assistance with rent payments.
But
So
this
it
time
was-
around, that
This
would be-
time around, and again,
that
being that we're, it's for a 3-year period upcoming, that's why we anticipate, we don't know how long the funding will be available through the other program areas. And again, how willing landlords or how able they are to wait for the timelines that it's taking currently for people to go through that system.
And I think that's a huge point, because you can have moratoriums, but if you have landowners or landlords that probably have mortgages, responsibility, we're still gonna try to
Exactly.
collect the taxes from them.
Yep.
Right? So at some point, you have to kind of keep the whole funnel full.
That's
And
absolutely
I know that's
correct.
not your,
No, but you're absolutely right, and it would be, attempting to make landlords whole where they have been on hold for these payments for so long.
Right. Okay.
Absolutely.
Any other questions?
No, Madam Chair, I'll just say that, I mean, this is exactly what this money's
Yep.
for. So, I mean, it's a pretty easy allocation. I'd go ahead and move approval of the resolution.
I'll second.
Okay, motion made by Commissioner Dolan and seconded by Commissioner Brandt. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. All those opposed, same sign. That motion carries. Thank you.
Thank you.
All right, moving on to our next item on the agenda is to consider American Rescue, oh, you got more, Amanda? Are you part of the American Rescue
I
Plan?
don't know, Dan?
got about 40 pages in here.
So, consider the American Rescue Plan Act, ARPA, update and recommended approvals and expenditures.
Good morning, Commissioners. 2 weeks ago, I promised you several requests this week, and I think we had 70-some pages in your packet today. For expenses under $50,000, the weekly awards are $121,567.51, and the list was included in your packet. So I'd like to approve those first before we move into the over $50,000 request.
Madam Chair, I'd move approval of the attached list of expenditures for ARPA.
Motion made by Commissioner Dolan,
I'll second.
seconded by Commissioner Phobie. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. All those opposed, same sign. That motion carries.
Thank you. Now we'll turn it over to Amanda for her HHS.
All right.
All right. Hearing none. So as you all know, COVID has really changed the way we work. Everyone knows that virtual meetings are here to stay. And the way that HHS interacts with clients, in particular a virtual platform that is secure as well as client-friendly, is really critical. So during these last 18 months, we've had the opportunity to vet them all, from Google Meets to Zoom, WebEx, GoToMeeting, Teams, and without a doubt, after surveying staff, that Zoom provides us the most security as well as the most client ease. We've also had a chance to vet who is using their Zoom licenses. So you may remember that there's a similar request for CARES, and so we funded Zoom licenses, and then during that time frame, we really monitored who was using them and then where the critical need was. And so we have 106 active users in HHS, and so this is a cost for 3-year Zoom licenses at a $599 each for those 106 active users.
Now, this is coming out of the ARPA funds
Yes,
then?
ma'am.
Okay, I would be looking then for a motion to approve the Zoom licenses for HHS staff.
I so move.
Motion made by Commissioner Brandt. Seconded by Commissioner
I'll second.
Dolan. Any further discussion?
I think just a question,
Commissioner
Chair,
Kobe.
that just other departments, I would assume some of them are going to also need Zoom licenses going forth, and maybe some were under 50 or have been, but just curious.
Yes.
Yeah, Madam Chair, members of the commission, Commissioner Phobie, yes, there are other departments that are using Zoom. Dan, I don't know if we had any in this group.
There was one in next group, and they'll continue to come over the next couple months as
Okay.
Yeah.
people's existing licenses expire.
And just a broader response, Brian is shedding other ones that we used, that we paid for, that we don't necessarily have to use anymore. So we're kind of settling down on Zoom, and obviously we have the Microsoft platform, but we still get some weird requests for other ones. So we are trying to keep cost containment so we don't have multiple systems and, 3 on every computer.
Okay.
Madam Chair.
Yes. Commissioner Sneezy.
I'm fine with this. I just want to make sure that we aren't migrating to a work from home environment without having a board discussion that, clearly defines what we want to do. I look forward to that in the future. I don't think we've really had that yet, but I can understand the need for now, so.
All right, thank you for your comment. Any further discussion? Hearing none. All those in favor signify by saying aye.
Aye.
All those opposed, same sign. That motion carries. Okay.
All right. Still have a few more.
Okay.
This
is
one.
Amanda show.
Sorry. This one I probably talked about the most, so this might not be new news to you, but this is the one where I really see some of the most critical need. This is really how we are shifting our thinking in more of a prevention mode versus always attending to crises happening. And as client needs become more and more complex, we're seeing those crises happen more and more. So this is for a 0.5 adult mental health social worker. Much to the chagrin of the adult mental health unit, I've been holding the other 0.5. That 0.5 FTE has been open probably since March, and that person was really dedicated to working with cases with people on civil commitments. The numbers are rising, but I believe that we can do better than just working the churn of civil commitments and really have a more prevention-based lens. So before people are a danger to themselves or others, what can we do to get those people connected with services? So I have a few more slides on this, so I apologize, but again, I think you've seen this before, the civil commitment need, both in the petitions filed from 2019 to 2020, as well as staff hours dedicated to working cases where there's been a civil commitment filed. Want to spend a little time on this one. So the blue graph is our regional treatment costs. So when folks are at regional treatment centers after they've had a civil commitment, you'll see how that number has increased. And then the red line is our detox. I want to tell you that our regional treatment cost in 2019 was just under $300,000. In 2020, it's $333,000, and in 2021, it's projected to be $346,000. Now, what this graph is not showing you is we had a recent MIND commit, and so that person now does not meet medical criteria at AMRTC, and so we are paying $1,600 a day for that person to get into a state-operated facility. So we are projecting that cost to just of that one person to be $183,000 to $331,000, depending on when that person is able. So this graph does not reflect that. And then again, that's kind of an outlier, so these trend lines don't include that information.
Madam Chair,
Yes, Commissioner
where do
Sneese.
we send people for detox?
St. Cloud.
St. Cloud, so that's through Central Minnesota Mental Health Center,
Yes.
their detox, almost exclusively. right?
Yeah. There's another one in Plymouth, but really when we look back at all the detox are in St. Cloud. So when I talk about the prevention lens, people who are using systems like detox jails, emergency rooms, often do so inappropriately. They end up needing deep end crisis services because they have not gotten services and supports on the front end. And so these folks are typically chronic users of these systems. They are not on caseloads or being treated for their conditions appropriately. So really, these people keep operating in crisis, as well as become very costly on our systems. St. Cloud has a team of people identifying these frequent flyers, and we're trying to steer away from that term, but really high system utilizers. And so a lot of times these folks are identified because law enforcement gets called very frequently. And so what the St. Cloud area is doing is that they are proactively working to get folks on services and then provide them intensive case management. And then they have a caseworker to work with a small caseload of people, as well as a multidisciplinary team getting these people. So you'll see that in their pilot of this program, that these people had decreased uses in almost every area: detox, jail admissions, police department contacts, as well as emergency department admissions. And then again, this is just showing their 2019 numbers. They take the individuals served. So here, St. Cloud had 47 individuals they worked with. They measured detox, emergency room visit, law enforcement encounters 1 year prior of these individuals, and then 1 year post, and then they noted the percent had decreased. So we know that this works, this prevention lens, and we also know that these costs, some of these costs have very real impacts on county budgets.
Amanda?
Yes, please.
I'm just curious, and when we're dealing with detox and that situation, is that where do, on average, most of the people that need those services, are they home-based, or are they homeless, or is there a tracking of any of that?
Do you know?
I don't have data on where they were prior to detox. I know
Okay.
like medical assistance status is basically
Okay.
what I know.
Just curious.
Yeah.
Okay.
About 61% are on medical assistance and known to the system.
Okay. Thank you.
And again, prevention is the right way to move, and so we'd like to move in that. And so then you say, why do we need another staff? And so we've really done some examination, particularly through holding this 0.5 FT, and we just simply don't have the capacity with our current staff to do this work. Currently, our adult mental health workers do have a wait list, and these folks who we are talking about are very high utilizers. They have very complex needs, and they're not people who will pick up a phone and say, yeah, sobriety, I hadn't thought of that before, sign me up. These are people who will need very intentional outreach, probably numerous outreaches, and really will have to work to have a carrot dangling for them to accept those services and supports. And then obviously the goal with them accepting services and supports is that stability, so then they'll stop using inappropriate systems.
I know, Amanda, on our end, we've always been supportive of the trying to put an ounce of prevention to equal that pound of cure. So I'm just curious, have you done any number running as to adding this person? Where do you see the benefit of bringing the costs down? I know it's going to take time. I
Yep.
get that.
Yep.
It's not going to happen overnight.
And again, what we know, we're making those assumptions based on past practice. And so when you see the decross, again, knowing that some of these don't hit county budgets, but when we talk about a sustainability plan, there's going to be cost decreases in systems. But in terms of the HHS budget, what you'll see is you're going to see hopefully decreased civil commitments because we're able to intervene prior to that imminent emergency, as well as a decrease in detox costs for the HHS budget.
Great, thank you.
Madam Chair, this
Yes.
is just a quick question. You may have the answer, you may not. Somebody can get it for me. For detox, if they go to Central Minnesota Mental Health Center, at what level do they reject them?
Tony?
Do we know, is there a number, if they're 2.5, 3, that where they won't take them? Same thing with emergency rooms and our jail. Does our jail, at a certain limit, because the risk with those people detoxing and actually surviving goes up dramatically, so.
I can get that for you, Commissioner. I don't have that.
Thank you.
Thank you.
Okay.
Chair, also, I think with, I don't believe they reject many. And they're moving to a model to have medical support built in detox. So.
Yeah, no, I know but
Yep.
it's a big deal, and it
Yeah.
has created some very significant liability issues if you don't get those people where they need to be.
And the other thing I'd like to say is this takes me back 2-3 years to I sat at the AMC conference on this model from City of St. Cloud, Stearns County model, and I was on fire with it. And so I think if you go back a few slides to those 5 people that they indicated and look at the less time spent and the money, the total savings, I have wanted this for years. So I hope that we are able to identify our 5 people that are costing our county thousands of money, thousands of dollars, and be able to identify how best to give them wraparound services and to get them the help they need so they don't end up in detox or our jail or whatever. So I'm thrilled to see this. It's hard to wrap your head around it a bit, but it's about prevention and looking at those people that really take up a lot of staff time and dollars. So I'm thrilled.
If I can just add one other thing, we know that the need has existed for a long time, but particularly with the implementation of our co-responder, that gap has become so evident because our co-responder is finding these folks and he is going to those repeat households and then he passes off to HHS, and to not have that person dedicated where there can be a warm handoff, I think it's going to be very easy to, again, build that continuum now that we have that piece in place.
Okay.
So I hope to see a graph like this in 3 years of Sherburne County residents.
Noted.
All right. Anything else then, Amanda?
No, ma'am.
All right. Thank you for the presentation. So with that being said, I'd be looking for a motion to approve the request of a 0.5 mental health.
I so move.
I'll second.
Motion made by Commissioner Brandt and seconded by Commissioner Phobie. Any further discussion? Hearing none. All those in favor signify by saying aye.
Aye.
Aye. All those opposed, same sign. That motion carries.
Madam Chair?
Yes.
Are all of these, we're looking at a string of positions here. These are ones that we talked about in the past? You came to us with a group of, so these are really nothing new. We aren't, okay.
That's why I said at the beginning, it feels like I'm a mile 20 of a marathon because we've been
Okay,
talking
well,
about these and this is the final.
Clarity
Yes.
for me.
Jody's going to talk about the next two.
It looks like we're just going to use some ARPA funds to start the process.
Good morning, Madam Chair and Commissioners.
Good morning.
I'm actually going to work backwards on the slide. I'm going to start with this slide about our out-of-home placement costs, and we talked a little bit about this last week during our budget presentations. So this shows what we're seeing for increases in our out-of-home placement budget from 2020 to 2021. In the area of family foster care, we've seen some increases in regards to court delays with COVID. So we have probably 6 families where we have multiple children in foster care.
that their permanency trials have been pushed back up to 6 months due to court delays. So we looked at those increased costs as being part of this request. And also, as we had previously talked about, our increase in group home correctional and residential placements, we really have identified that the needs of the kids being served on our children's mental health aid have really driven those costs up due to the seriousness of their mental health that we're seeing them come in with. So our request is a request for $240,000 to help recapture some of those expenses in our out-of-home placement budget. I can answer questions if you want more specifics.
Any
around
questions
this.
for Jody?
You're refilling the bucket, right?
Yes.
I make the motion.
I'll second.
Motion made by Commissioner Smeezing and seconded by Commissioner Fobi. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those opposed, same sign. That motion carries. Thank you.
Thank you. One more. Okay, so our other request is for a full-time children's mental health social worker. And again, as we just talked about with the out-of-home placement cost, this really drove this decision to bring this forward as well. We are spending the cost on out-of-home placement in this area due to the needs of the youth that we're serving. So what we'd really like to do here, again, is shift the funding to a staff person who could really work on some prevention. Specifically, this children's mental health social worker would be providing rapid response services and relative search in our area of children's mental health. So you might have heard us talk in the past about family group decision-making and that impact that that has really had in our child protection and child welfare cases to keep families together, prevent out-of-home placement. And so we really want to shift some of that work to our children's mental health area. Up to this point, we haven't had designated staff time to be able to do that work. So again, to kind of combat those deep end services, we would like to have a social worker to be able to do rapid response, crisis planning, relative search to be able to find relatives and supports within the family to provide care to the kids before the point of crisis, hopefully preventing out-of-home placements.
All right, any questions?
Madam Chair, this is for
Commissioner
3
Smeezing.
years, right? The 331,000 is for 3 years.
Yes.
And that's what all of these represent. So, and the money runs out. This is going to be ARPA funds. And we are going to be making sure that as we get to the end of this, that we aren't get there and say, hey, we got positions that.
So this is also an area where we could generate some targeted case management revenue. I would also say, again, saving on the deep end with our out-of-home placement costs. I think we will see a reduction in out-of-home placement costs in this area.
I think, Commissioner, too, you've asked for accountability with these, and so we've been pretty transparent with, where we see the sustainability plan in certain positions like the housing one, where the sustainability plan is hopefully looking for additional grants and sources of dollars. And so the sustainability with these two is we really feel that we're gonna see decrease costs in the HHS budget, and we'll be sure to bring that back at the end of 3 years to show if that's true or not.
Well, I may not be here, but I mean, at some point you have to be able to explain why this funding is gone and now we need this funding and where it's going to come from. And I just don't want that lost for a future board.
Understood.
So I will make that motion.
Motion made by Commissioner Smeezing,
I'll second.
seconded by Commissioner Fobi. Any further discussion? Hearing none. All those in favor signify by saying aye. Aye. All those opposed, same sign. That motion carries. Thank you.
Thank you.
And then, Madam Chair, members of the commission, you approved the policy for the $100,000 emergency assistance program. We actually would need a motion to designate the recommended $100,000 for that program.
All right, looking for that motion?
I'll move approval.
Motion made by Commissioner Fobi,
I'll second.
seconded by Commissioner Dolan. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. All those opposed, same sign. That motion carries.
Next, we'll turn it over to the Sheriff's Office, who also has a couple ARPA requests as well.
morning, Commissioners.
Good morning.
This isn't any new information. We had provided this in a board workshop and then also in the budget workshop in terms of the mental health services in the jail. And so we're looking to collaborate with Health and Human Services to put 2 licensed clinical social workers in the jail. Some of the information that's been provided in terms of mental health encounters, we looked at 2019, we had 2,500 mental health encounters in the jail. 2020, we had double mental health encounters in the jail. Reducing our inmate population really by half. We've also increased the mental health encounters in 2021. And so we're looking to add the mental health social workers in the jail to help with more intensive mental health services. We did look at a model in Washington County, and they are starting to incorporate mental health social workers in the jail. And early indications, they've been very successful. So other county models are looking to do the same. Amanda and her staff looked at some of the different services that the clinical social workers would provide within the jail setting: diagnostic assessments, developing treatment and crisis plans, case noting, conducting individual and group therapy sessions, so on and so forth. A litany of things that provide more services and more intensive services to the inmate population that we have. In terms of sustainability, the overall budget that would run through 2024, so the last quarter of this year through 2024 for 2 licensed clinical social workers. My understanding, clinical social workers are the highest level licensing, so they can do the diagnostic assessments, so they're not inexpensive staff. The overall budget for through that time period through 2024 is $721,447. And so we look at the not only the need aspect of it, again, half the inmate population, twice the mental health encounters, but we also look at the sustainability, is how we're going to pay for it after ARPA funds run out. And so we would anticipate using county levy dollars to be commensurate with the county inmate population. So we're supporting the inmate county population with levy dollars. And we would incrementally add a little bit of levy dollars each year. So we are sustainable when we come to 2025. And then we have a large portion of our population are federal inmates. And the sustainability of this program would be contingent then on those conversations and per diem increases with our federal partners to support the mental health services in the jail. And again, this is to supplement what we currently have in place, but our federal partners have been more than open to those conversations with the mental health services. We've already received some per diem increases on some 8-hour watches inside of the jail. And we're in current contract negotiations with one of our federal partners as we speak. With that, I'd stand for any questions that you might have.
Any questions? No, I think we're all aware that mental health is becoming more and more a priority to address, and especially when someone is in jail. Makes sense.
I'll move approval.
Motion made by Commissioner Phobie.
I'll second.
Seconded by Commissioner Brandt. Any further discussion?
I just also, a comment on that it's important for our people that are incarcerated, but even more important for our staff.
Mm-hmm.
It's a protection measure for our staff and assist for them, so.
Agreed.
And Madam Chair, I just, as we do this as well, it will have to be integrated properly and documented properly, because we will be subject to liability issues. No matter what we do, we end up in that box, and so we always have to do the best we can to keep from getting caught in it.
Noted. Any further discussion? Hearing none. All those in favor signify by saying aye. Aye. All those opposed, same sign. That motion carries. Thank you.
Madam Chair, Commissioner, good morning.
Good morning.
I'm Matt Albrecht, Information Services Director for the Sheriff's Office, and I'm going to shift gears just a little bit. I'm going to do my best to keep things less techy to make the conversation go a little bit better. The capital request I bring for consideration is an ARPA request, and this request is totaling $99,502.29. It's a request to replace existing server hardware that will be reaching end of life at the end of fiscal year '21. The hardware is a set of 3 hosts, virtual servers, that will be replacing the same count with more capable systems. The current set hosts 35 virtual servers, and the replacements will initially do the same. It is also phase 1 of a 3-year plan to add service and support to all infrastructure systems that are currently out of support or expiring in the next 16 months. Reduce the overall physical server count by 19 as we work towards a fully virtualized environment, large cost savings there. And the virtualization of our 12 aged Genetec camera systems, which hosts 400 plus cameras for both our jail and public. This in addition to server systems that support approximately 75 body cameras used by our patrol deputies. It will also provide resiliency and operational recovery for the Sheriff's Office server systems. And then lastly, the planning and implementation of a business continuity and disaster recovery plan for the Sheriff's Office systems in fiscal year '23. And with that, I'll pause for any questions you might have for me.
Any questions? No, we definitely have to keep up on our technology, for sure.
Yeah.
Madam Chair, I'll make the motion.
Motion made by Commissioner Smeezing, seconded by Commissioner Brandt. Any further discussion?
All I can say is I started to look down the list and I thought, what are they ordering, a bunch of squad cars? We got ourselves a Power Edge and a tailor-made, maybe golf clubs. I didn't know. And I had to look all the way, oh, this is technology, so. That's
very good. Thank you for your time.
All right. Any further discussion? Hearing none. All those in favor signify by saying aye. Aye. All those opposed, same sign. That motion carries. Thank you.
I just want to note 2 more things. Several of those requests were using the lost revenue parameter of the ARPA, and you'll see on the first page, I am keeping track of what our total funding that we're spending on lost revenue on that sheet. And we also received a request from Promise Neighborhood that the Risk Assessment Committee did deem eligible use. We would like to have them come and present their program in a workshop setting, so we think we pulled that one for today, and we'll probably have that in September, have them come to a workshop and just a little more detail on their program.
Perfect.
Just an update on the business relief that did go live last Monday. We've gotten about 6 applications so far, but we've had dozens of calls, so that we are anticipating several more applications to come in.
Okay. All right.
Thank
you,
you.
Dan.
Thanks, Dan.
Madam Chair,
Yes.
Dan, before you sit down real quick. Where are we at as far as the creation of a nonprofit program? Last time for CARES Act, we mirrored the business program to a certain extent. Are we looking at doing that again? And again, the Promise Neighborhood thing, you know, raises that flag. It's our first non-internal request coming through a process that's more designed for internal requests. So I just wonder where we're at as a board and where we're at with staff as far as developing parameters.
That's a great question. We've had the internal discussions about what that would look like, but we haven't moved forward with that. So I think we could, Tim, if you want to jump in, we could draft one that's similar to our one that we utilize for the CARES program.
Well, and yeah, and even if it's a workshop to just have general discussion about what we want to hit, I think it'd be pertinent to do it, because I would imagine we'll start to see more requests and we want to have a lane for them to come in.
I think a workshop item would be helpful, just to identify what the board wants us to target, because frankly, that's been some of the discussion. You know, are we still looking at losses to keep people propped up? Or do we want to target certain services and neighborhoods, things like that? Because that's kind of where the guidance pushes you. So feedback from the board, I think, would be extremely helpful.
Great. Okay, so you'll get that taken care of then? Perfect.
Thanks, Dan.
All right,
Thank you,
thanks.
guys.
Yes, Commissioner Brandt. Did you have something?
Oh, I was just going to add, piggyback on that. Yeah, and I think if you're okay, we can do that and have Promise Neighborhoods come in and talk about theirs at the next workshop in September. The Promise Neighborhood one's kind of weird because it came from the Stearns County, and we did entertain bringing it to you as possible joint powers. There doesn't seem to be a good way of transferring funds because we would still be essentially responsible for the federal funds if Stearns administered. So now we're thinking, as you heard, that it's more of a standalone agreement with the nonprofit that will mirror Stearns, but it would be a Sherburne County project if you approved it. So it's probably good that we discuss it in both the specific item, because it'll be the first one, but also the policy.
Okay.
Well, I think it's important that we discuss what they're gonna do and what the program amounts to, rather than just worrying about the function, about we shift the money. I think we need to know a lot more about what they're gonna do.
Yeah, and I'm wanting to see us get something up for the nonprofits, because they're still hurting as well. So, okay, so we'll look forward to that at the next workshop. All right, thank you. All right, moving on to our commissioner correspondence and committee reports. Who is ready to kick us off? Commissioner Smeezing, you were kind of like sick, so you probably, what do you
I
have?
had budget, I was
Yep, you were on.
involved in them, and then I also had the MICA meeting that I attended, or did virtually last week, so.
All right. Thank you. Commissioner Phobie.
I had a couple AMC Futures leadership meetings, and then Great River Regional Library Board met for the first time in person. So that was pretty great. Rum River One Watershed One Plan met, and the budget workshops.
All right, thank you. Commissioner Brandt.
The budget workshops and a COVID-19 steering committee with the HHS and on the 6th. And I go and chat with people at the Legion on the Saturday mornings every few months, and that was on the 7th. And I listened in on a virtual meeting with Tom Emmer talking about issues for our area on the 10th. And I went to the church, county, and community program that was held on the 11th here, and also chaired the First Steps virtual meeting on the 13th.
All right. Commissioner Dolan.
Yeah, Madam Chair, pretty light beginning of the month for me. Obviously, the 2 days of budget workshops with everyone, and then I've actually spent a few hours out at the Elk River Farmers Market with them on their comprehensive plan rollout the last 2 Thursdays. So.
Do you get a lot of feedback through that method?
Yeah, no, the one nice thing about it is, with us going into our comprehensive plan, most likely in the next few months, it's been a good process to be part of and kind of see some best practices and where resources go. But yeah, no, there's been pretty substantial interaction at those farmers markets. They got a booth right when you walk in, and staff it with a couple staff members and then a member of the committee, and answer questions and get feedback. So
Maybe that's something we can look at through our process. I know that a lot of the farmers markets go winter farmers markets as well. They just bring them indoors, so that's something to consider.
Yep, absolutely.
All right, anything else?
Nope.
Oh, okay. I attended, the Employee Appreciation Ice Cream Social on August 3rd. That was a lot of fun. Serving rock hard ice cream is very interesting, but we got through it. August 5th and 6th were the budget workshops. Also on August 5th, I attended the retirement recognition of Nancy Riddle. And August 12th, APO board meeting. And August 13th, the 7W Transportation Policy Board meeting. And that was my, okay. Moving on then to recessing our regular meeting and opening our Ditch Authority meeting. Andrew, are you in charge of Ditch Authority? Looks like it. Did you bring pictures? We always usually get pictures.
Thank you, Madam Chair. I think first order of business, you probably want to approve the agenda for the Ditch Authority meeting.
Okay, looking to have a motion to approve the agenda for the Ditch Authority.
Move approval?
Motion made by Commissioner Phobie.
Second.
Seconded by Commissioner Smeezing. Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
All those, did I say opposed? Okay.
You did now.
I did now. Okay, all those opposed, same sign. That motion carries. All right, moving into receiving and approving the drainage technician's report.
Yes, thank you. I'll be covering for Mike Linnenau. He's enjoying some time out in Colorado and Utah and visiting our national parks. So I don't have any great pictures like he normally has, but I'm here to ask if you have any questions on the written report he submitted. Along with that, as everybody's aware, we're in the midst of a drought right now. Again, it's not great for the community. It's not great for most people. We're taking that opportunity to take a look at a lot of our infrastructure that we don't normally see because it's underwater. So the good and bad news is we do have a few of our ditch systems that are completely dry right now. We're actually taking a look at televising a culvert that we have or a pipe that we have underneath the Burlington Northern Railroad that's about 100 years old. That's dry right now. So we need to get in there and get that jetted out, get some silt and material out of that pipe before we go in there and video that. But those are some of the opportunities that we're seeing with these dry times right now. But as Mike states, it has led to a little less intensity to managing our ditch system over the last couple of months. So cross your fingers, maybe we have a wet fall and hopefully we can get some great pictures the next quarterly report from Mike.
Hey, Mr. Schmeezing.
And hopefully we don't have problem pictures, but when Mike gets back, maybe you could ask him, I was at a town board meeting and just have him visit with John Herbst Construction. He was talking about, there's some opportunities here, and I think you guys recognize that. I mean, there's areas that are dry that are normally wet and work that maybe can be done that would be easier to get done now. But if he'd just have a little contact with him, I told him that I'd have him visit with him. But yeah, now would be a great time. And some of those I think about the one with the floating bog. I wonder what that looks like, this year. It would have been probably a great time to do it. But at any rate, that's.
Okay.
Thank you.
Any other questions? All right. Hearing none, then I would be looking to approve the acceptance of the technician's report.
Move approval.
Motion made by Commissioner Schmeezing, seconded by Commissioner Brandt. Any further discussion? Hearing none, all those in favor signify by saying aye. Aye. All those opposed, same sign. That motion carries.
Thank you.
And then looking to approve and authorize, thank you, Andrew, AKA Mike. Approve and authorize the billing of proposed 2021 county drainage assessments.
Good morning, Commissioners. Bonnie is handing out the assessment sheet that gives all the detail and stuff in there and the total amount for the assessments. We did provide in your packet as well is the listing of those $100 or over ditches that were going to be assessed. But you do need to have this one here too. So this one,
Okay.
apologize. Whoops, Bonnie.
Sorry, I have a blank one.
Thank you.
Thanks.
So with that, we calculated out the ditch expenses from last July through this year, and we came up doing the calculations and what ditches do owe back to the county, et cetera, for work and stuff that's been done. So I'm recommending the following ditches: ditch number 1, ditch number 4, ditch number 6, ditch number 28, to be assessed, those amounts that I've listed there in the total. The grand total for the assessments will be $45,450. I also wanted to let you know that as of right now, where the ditch fund balances are, is that they owe the county back for repairs and stuff that we have occurred, or for fund balances that were negative. We're at $18,756.90. Also to let you know that the interest on these assessments, if people decide to let them go and become part of their taxes for 2022, is a 0.02% interest rate. That's what we're getting on our money.
Yeah.
So that's what we.
I'm assuming they'll probably put it on their taxes at that kind of an interest rate.
So that is 0.2%.
Any other questions for Diane? All right. I'd be looking then for a motion to approve the billing of proposed 2021 county drainage assessments as presented.
Madam Chair, I'll make that motion.
Motion made by Commissioner Dolan,
I'll second.
seconded by Commissioner Phobie. Any further discussion? Hearing none. All those in favor signify by saying aye.
Aye.
All those opposed, same sign. That motion carries.
Okay, thank you very much. And then those billings, we'll get those put together and printed, and the notice is sent out to the people, so they have an opportunity, if they wish, they can pay them up ahead of time before they would go on as part of their taxes. So,
All right, perfect. Thank you, Diane.
thank you.
Okay, at this time then, we will close the Ditch Authority meeting and open our Regional Rail Authority meeting. And I would be looking for a motion to approve the Regional Rail Authority meeting minutes of August 3rd, 2021.
So moved.
Motion made by Commissioner Dolan,
I'll second.
seconded by Commissioner Brandt. Any further discussion? Hearing none. All those in favor signify by saying aye. Aye. All those opposed, same sign. That motion carries.
Madam Chair,
Yes.
I would like to add something to the agenda of this. So we didn't have an agenda approval but I just want to talk about
Okay.
North Star. I guess we can go ahead and do
We can do North Star at the end of the,
yeah, I'll do a little discussion at the
Okay,
end would be fine
perfect.
for me.
all right. And I do not see where, so we probably should approve the agenda for this Regional Rail Authority meeting.
So moved.
Motion made by Commissioner Brandt. Is that with including the addition of the North Star discussion? Thank you. Looking for
I'll
a
second
second.
that.
Motion, or seconded by Commissioner Schmeezing. Any further discussion? Hearing none. All those in favor signify by saying aye.
Aye.
All those opposed, same sign. That motion carries. All right, looking at consider the approval of the 2022 Master Funding and Annual Operating Grant Agreement of the North Star Link commuter bus. Andrew.
Good morning again, Madam
Good
Chair.
morning.
So this item on behalf of County Administration and Public Works handles this, together. Did come before the board last meeting and there was some interest and some continued discussion, and I think that's a great idea. So this is considering the approval of the 2022 to 2026 Master Funding Agreement. So this is the overarching, the main agreement between us and Link for the 5 years. Annually, there will be also a subordinate agreement that comes along with this for approval each year. But this is the Master Funding Agreement. So as we discussed last time, there were some modifications and some changes, as we're aware, and they made it clear to us very early on that Anoka County is no longer a partnership in this agreement. So that transfers a minor amount of the costs to the remaining partners within the agreement. We appreciate the review of the County Attorney's Office as well. They've highlighted a few items that I want to bring forward for consideration and discussion before we take a look at maybe approving this master funding agreement or going back to request some modifications from for the agreement. If I can highlight a couple of them, they have a few changes in there. They're talking about transitioning their quarterly financial reports to, or I'm sorry, their monthly financial reports to quarterly. We may want to consider keeping that monthly, and I would think that's something we could request of them. They also are talking about, in this new agreement, providing an unaudited year-end report in April versus our normal audited year-end report in July. Again, there might be some advantages and disadvantages to that, being able to provide some of those comments before it gets audited or the other ones that were highlighted by the County Attorney's Office was to modify the report that triggers their obligation to return any surplus. So I think that's worked out pretty well in the past. That's something we would probably want to maintain from the last agreement into this master funding agreement and make that request. And then lastly, the last one I want to bring forward that we consider to be fairly substantial is it would require the Regional Rail Authority to pay for 20% of any bus purchase, whereas the last agreement noted that it was only on certain vehicles. So we can dig into that and provide a little more detail in regards to that. So the next section following that one also then relates to getting rid of vehicles and the return of the money, and that does not really track through the new agreement either. So there's a number of probably 3 or 4 items that we probably would like to see modified and changed maybe before we provide, the approval of this agreement. Or we can provide an approval contingent on those changes as well. So with that, I'll open it for any discussion or if there's any comments from the County Attorney's Office as well.
Any questions for Andrew? Commissioner Smeezing?
Well, maybe I should jump in with where,
the
where
North
I'm
Star
going with this to
discussion?
some degree. My issue is, I mean, I think you're doing a fine job of reviewing this and going through this and watching out for us in the best way possible. I just think it's time for this board to sit down and consider North Star, the commuter rail, the bus, and to have discussion with our partners. We're marching along, partners are leaving, we're not even talking about it. I think, I've asked for this before, and I hope that we can get somehow, kind of talk about how many people are riding, what's going on here. Are we, we're spending a lot of money on this, and I don't think we're being as responsible as we should in practicing the due diligence of what's going on there. So, I've been contacted by a Anoka County board member that wanted me to do a joint letter asking us to leave the commuter rail. Well, I'm not about to go doing things like that without consideration of my fellow board members and discussion. So how do we get that discussion to happen? I don't know, because it will take, somebody's gonna have to put some things together, and we're gonna have to sit down and discuss it, and we're gonna have to discuss it not only among us, but among our partners as well.
Yep. And I agree with what you're saying, Felix. We need to have that discussion. My concern is that in discussion, I think we need to understand too that nobody in the metro is bringing back a full contingency of workforce yet. They're pushing it. So it's hard to make these decisions in what I would call an unprecedented vacuum of the pandemic. So I would be kind of concerned about pulling the plug on something during a period of time where it's not able to be operating like it was intended to operate. But I do agree that we need to be reviewing this, and we need to understand what direction Anoka is taking, because on the other end, we still have St. Cloud that is very much in favor of moving forward to that extension. So it's kind of a real interesting conversation.
Chair?
Yes.
We're getting into discussion, it seems like already, so this is exactly why we need
Yes,
a workshop.
yes, yes.
And I totally support and wonder, when I hear Anoka has pulled, how did that happen? How were they able to do that? And the total impact on us. I'd like to see a lot more detail on that. How does that all happen? And do we have that option? Is that something we want to consider? So I would agree with Felix. I just feel like we haven't had discussions at all, and I feel kind of like it's a big black hole.
Yeah.
Yeah, and I'm not trying to lead us anywhere.
No.
But we do need to discuss it. We do need to talk about it and see where we're at with it. And I think it would be more responsible of us to be doing it as a board and to be doing it with our partners.
Yep.
I mean, Anoka pulled out, okay. I never heard they never asked us how we felt about that or where we were at with that. I think that it would have probably been a little better if we could have had a conversation among, there's not just, there's a number of us that are involved in this. So Hennepin,
And
Anoka, Sherburne, and Stearns are
They
involved
just-
in the bus.
They just pulled their bus portion of it right now, right?
Right.
They're still involved in the other aspect of
Yes.
it. And that bus portion was down to, what were they paying a year? 100
Yeah,
and,
Madam Chair, County Board members, so their contribution was roughly about $6,000 to the link is about all it was. They actually, if I go back and search through files, I believe they actually wrote a letter a couple of years ago that said that they did not intend to continue forward once that last master funding agreement expired, which would be the end of 2021 here. So they did notify us that they were no longer intending to enter into another master funding agreement in regards to that, so.
Yeah, let's get a workshop
Mhm.
scheduled for this discussion. Bruce?
Yeah, we'll schedule it. A couple things. First of all, with the board's permission, Andrew will still look at those specific
Yep.
areas that we'd like to see changed, unless the board wants us to suspend any conversation until you have the global one. Otherwise, we'll do dual track. We'll get it scheduled. The other thing is for a partner meeting, I'm wondering if the board would be comfortable, instead of having a joint public meeting with essentially 3 county boards, trying to get Hennepin's board and together, if we just ask for a meeting with our partners and then include a commissioner as well as staff, if that'll be okay with you. I mean, still we'll do our workshop, but to speak with the partners, it sounds like you want that at the commissioner level.
I was just curious, I know there was a period of time with North Star that there was a regional board, I don't know what the terminology.
NCDA, North Star Corridor
Yes,
Development
yes.
Authority.
That had been created. They were suspended after a period of time because everything was kind of up and running. Maybe it's time to revisit that idea and looking at, being as we're having some significant changes that we have to address, maybe it's time to reinstitute that board again through this discussion as to what the future in North Star is.
I think at this point, for the purposes of getting some discussion with partners going, I think you invite Hennepin County. I think it's probably more critical that we and Stearns County, if we can meet together
Yeah.
and, you know, even as boards, I don't know, but I mean, we should.
Well, Lee Linsmeyer was the chair of that board for a good number of years as well, so they were always at the table for the discussion of North Star.
Madam Chair,
Yes, Commissioner Dolan.
I guess my personal comfort level would be that we have our board workshop, so we know as a group
How we
where
want.
we're headed before we bring anyone else into the conversation. I just want to make sure that our concerns and what we want to say is clear before we start mixing in a bunch of other opinions and perspectives there. So I'm in favor of all of it. I just think we should go in that order.
I agree.
Okay.
I agree too.
Well, then, yeah, we have another workshop that you could put together. Now, that being said, in discussion of the agreement with the bus, with the Link bus service, how do you want to proceed on that one? Do you want to approve the request based contingent on the change in some of the language that Andrew is looking at wanting to do, or do we want to have it come back clean?
Madam
Commissioner
Chair,
Creasy.
how does this language, I mean, we can't just change the language, can we?
No, we can't, Madam Chair, Commissioner Smeezing, we would have to go back to.
So you could work on the changes, I mean, I'm fine with what your changes, but I don't think we act on it.
So bring it back.
Or do we need to act on it, or?
No, Madam Chair, Commissioner Smeezing, as we mentioned last time as well, this doesn't take effect until January 1, 2022, so we've got some time. We can sit on it, we can work on those changes. We don't need action at this point. I think the direction that we've gotten from the county board is sufficient at this point to go back and work on those modifications.
Yeah, Madam Chair.
Yes.
And we kind of veered off track, but I shared some of the same concerns that Andrew pointed out, kind of the delineation of which buses are being used for this program. And one of the other things, and it might just be my inability to really digest the language, but with all the federal infrastructure, with ARPA, everything like that, a lot of these transit companies are getting pretty substantial federal monies. And I just want to make sure that those monies going into the program are offsetting the overall cost and not just Metro buses portion. I couldn't find how that language was delineated within even walking through the grant section, so just some clarity there. Again, it might be there, I just couldn't quite stick my thumb on it, so. But other than that, I think waiting to take action is the smart thing.
Okay. All right, do we have to have a motion then we're just gonna bring it back? All right, okay. Anything further to come before the Rail Authority meeting? If not, then we will close our Regional Rail Authority meeting. And at this time, we will be going into closed session.
Chair,
Yes.
can we take a break?
Yeah, we can take a, well, if I go, okay, we'll go into closed session and we'll take 5 minutes to come back. Can we do that? Or do I need to take a break and then go into
I think
closed session?
there's two choices. One is if we think it's going to be a short session, we can come back here to this room, but we have to be done by 11. Otherwise, we had scheduled to go up to the attorney's conference room, so we could take a break now and go upstairs. My comments will be short, so it's, I think from my side, I think we could get it done fairly quickly, but it's up to the board. Take a break here and come back.
All right, we'll take a 5.
Take a
that
5,
good?
and then that'll leave us 20 minutes.
Yep.
Okay.